Hello there, this is Dr. Emma Foraker, and today I'm going to be showing you how I would choose where to inject for filler to the cheeks. And so this is the kind of process that I use to mark up the patient for injection, and I'm going to be doing it on myself. So first things first, you want to make sure that you're putting the filler at the apex of the cheek, where naturally people should have the most fullness in their cheek. I see so much filler that's, and I'm sure you've seen this too, that when filler is placed too high into the lateral cheek, you can get the maleficent look, and that can be very unnatural appearing. There's a rule in aesthetics that, the cheeks and the temples should be about the same width, and if there's a huge discrepancy between the temples and the cheeks, that can make you look older. And so one way that happens is when people lose volume loss in their temples, then obviously that creates a discrepancy between their cheeks and their temples, and that creates a more aged appearance. But the other way people do that is they overfill the lateral cheek, and that creates a discrepancy between their temple volume and their cheek volume, and that can create a very aged appearance. So I do recommend you really focus on only the apex of the cheek, which would be considered more of the medial cheek area in the midface. The way that I like to figure out my points for injection is I like to take a line and take that down from the lateral canthus of the eye to approximately the side of the mouth, and then to the nasal ala to about the tragus. And this doesn't have to be exact because you're of course not going to do everything just based on this, but I think that this creates this nice area here in this little quadrant. And then, if you were to map out the eye, that could be helpful under the eye. And so this kind of quadrant right here is naturally where the light should be hitting the cheek. And so on this side, it would be about here, but I didn't obviously mark. And it also is helpful when you're placing cheek filler that if you draw this line for both cheeks, it's the way to get the most symmetry out of your injections. And then in this case, I'm talking about deep periosteal injections. There are certain ways that we can do cannula injection and fan filler. In this case, I'm talking about deep periosteal injections, which I think as a beginner, this is the first type of cheek filler that you should be learning how to do. And so basically, I'm going to kind of cut this into 5 different quadrants. 1, 2, 3, and 1, 2. And so if you can imagine that when I'm going to do this patient's cheek filler, and I have to make sure that I'm at least lateral to, the mid-pupillary line, because that's where we know the infraorbital notch / infraorbital foramen is, infraorbital artery being the most important thing that comes through that area. And so just lateral to that, which is perfect, that's exactly where we are. And what I'm going to do is deep periosteal injections in these 5 quadrants that I've marked out. And so depending on how much filler you're working with, I never recommend less than 2 syringes of filler, at least 1 syringe of filler per cheek, because splitting a syringe of filler between 2 cheeks is just not enough to create any, recognizable result. So maybe 0.2 injections in each of those or something like that. And so that's how I would recommend doing that. Of course, you're going to aspirate. Even when you get down to the periosteum, you'll aspirate before doing your depot injection. But that's a kind of quick and dirty way to figure out approximately where the apex of the cheek should live and where you should do your filler injections. And this is a 1, 2, 3, 4, 5 point injection. So if you have any questions, let me know in the comments below. Thank you.